Hi, my name's Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. I'm going to show you how to use the inhaled medications for asthma called the meter dose inhaler with an aero chamber. And you can see that this aero chamber has a mouthpiece, not a mask. So the mouthpiece is like that, okay? And what you do is you take the inhaler and you put it inside the aero chamber, you shake it, and you puff it. And this is meant for adults and older children that can control their breath so that they put their mouth on here and they take a slow, deep breath, inhale and hold it. So it's for children that are able to control their breathing at least that well, okay? So you shake it, and the mouthpiece like this, you puff it, and then you take a slow, deep breath in, okay? So you have to make sure it's not too fast. If you inhale too fast, then you'll hear a whistle. So you shake, puff, so you heard at the start, it just whistled a tiny bit, which is not a problem. But if you inhale too fast, you'll hear this. And that, of course, is much louder than what you heard. So what you want is you want an inhalation like this. And that's how it should sound. The type of drugs that we have that we use with aero chambers like this are the inhaled steroid medications. Some of the common ones would be Alvesco, Qvar, or Flovent. And then we also have combination inhalers like Advair or Zenhale that are meter dose inhalers like this. And then, of course, we have the old rescue inhalers like salbutamol that we still use as a rescue inhaler like this as well. So the drugs are different in terms of how they're used, but essentially the inhaled steroids and the combination inhalers are the maintenance inhalers that you use regularly every day. And then the bronchodilators are ones that are there to open up your airways. And I want to also illustrate one important point. Classically and historically, we've used the rescue inhalers or the salbutamol as a single medication to be used when you need your lungs opened up. Now, what I typically recommend, and some of the asthma guidelines recommend this as well, I typically recommend that when you use your rescue inhaler, your salbutamol puffer, then I also recommend taking 1 or 2 inhalations of your steroid. So that could be the Alvesco, the Flovent, or the Qvar. And you take the steroid with the bronchodilator, and that way you're getting the bronchodilation from the blue inhaler and the anti-inflammatory effect of the steroid. Classically, we recommend that for rescue. Now, with young children where they're not able to use the combination inhalers, what I would recommend if the asthma is severe, and again, this is a bit unorthodox, but I often recommend this for our more severe pediatric asthmatics, is to use the steroid and the bronchodilator regularly twice per day. And again, that's unorthodox, but it's a good way to get a combination inhaler into a young child. In other words, you get the bronchodilator and the steroid alone. And again, whenever you're using rescue, then I recommend using the blue puffer and then taking an extra puff or 2 of the steroid. This type of aero chamber, again, usually 6 years old and up or so, we would recommend this type of aero chamber. And we have them graduate to this when they're not, when they are able, to take a breath control, and they don't have to have the mask inhaler on. Importantly, if you need the rescue inhaler more than a couple of times per week, then you should see your doctor to make sure that your maintenance inhalers are modified. If you're having a more severe asthma episode where you take the rescue inhaler and you're not better, you take it again and you're not better, if it's severe enough, you should see the doctor right away. And if it's really severe, you should really go into the hospital to the emergency department. So that's how you use the puffers with the aero chamber, and typically how we approach using the inhalers for asthma. Thank you.